doctors of Reddit. What is the biggest mistake you've made? Serious. Not a big mistake, but definitely awkward at the time. I was gluing up a lac on a 14-year-old girl's forehead. Anyone who has used Dermabond before knows that stuff can be runny and bonds very quickly. I glued my glove to her face. Her mum was in the room, and I had to turn to her and say, "I am sorry. I've just glued my glove to her face." I missed a gunshot wound once. A guy was dumped off at the ER covered in blood after a rap concert. We were all focused on a gunshot wound with an arterial bleed that was distracting. The nurse placed the blood pressure cuff over the gunshot wound on the arm. We all missed it because the blood pressure cuff slowed the bleeding. I was doing the secondary assessment when we rolled the patient, and I still missed it. We didn't find it till the chest X-ray. The bullet came of rest in the posterior portion of the thoracic wall without significant trauma to major organs. The patient lived, but I still feel like I fricked up big time. When my dad was a resident, he had a guy come in with a gunshot wound to the shoulder. The guy had been caught with another man's wife and had been shot while running away naked. In addition to the shoulder, the patient kept saying he had been shot in the gut. Dad searched all over and couldn't find a wound. But the guy kept complaining about excruciating pain in his lower abdomen. X-ray revealed that, indeed, there was a bullet in the abdomen. Took a while to find, but my dad finally found the entry wound. The guy had been shot directly in the butt. Swish. A few years ago, I saw something very similar on ER. Yes, if enough people get shot, there are bound to be a few 1 in a million shots. Pathologist here. Biggest mistake I ever made was cutting myself during an autopsy on an HIV patient. Lucky for me, I did not acquire the virus, so everything had a happy ending. For me, anyway. That guy was still dead. I'm a nurse, but I was working in the ER when a guy came in for a scratch on his neck and feeling drowsy. We start the usual workups, and this dude's blood pressure tanked. We scrambled, but he was dead within 10 minutes of walking through the door. Turns out the scratch was an exit wound of a .22 caliber rifle round. The guy didn't even know he'd been shot. When the coroner's report came back, we found that he'd been shot in the leg and the bullet tracked through his torso, shredding everything in between. There was really nothing we could have done, but that was a serious what the frick just happened moment. This thread is pretty depressing, so I'll lighten it up a bit. A few months ago, I accidentally ran a creatinine test on a patient when a comp metabolic wasn't ordered. It turns out that the guy was in renal failure, and no one knew. He was about to go in for surgery. I believe it was a bypass, but could be wrong. But I got the results in time to stop them from putting him under. Crap, could have been messy. I'm glad I screwed up, and I'm sure he has no idea that he could have died. My brother is a surgeon, and during part of his residency, he had to work in the pediatric unit. He was working with 2 newborns. One was getting much better and fighting for life. He was going to make it just fine. The other baby was hours from death. He wasn't going to make it. My brother was in charge of informing the family. My brother realized about 15 minutes later that he had mixed up the families. He told the family with the healthy baby that their baby wasn't going to make it. And he told the family with the dying baby that their baby was going to be just fine. He then had to go back out to the families and explain the situation to them. How devastating. To be given a glimmer or hope and have it ripped away from you, not even an hour later. That was most upset I've heard my brother. He felt destroyed. As a very young doctor in training, I misdiagnosed a woman with epilepsy. Some years prior, she had sustained a gunshot wound to the frontal area, damaging the underside of one of her frontal lobes and severing an optic nerve to one of her eyes, as well as some of the muscles that rotated that eyeball. Surgery saved her life, but the frontal lobe was scarred, and the eye was blinded and always pointed down and at an angle away from her nose. A few years after that, she began having spells of a bizarre sensation, altered awareness, a pounding in the chest, and she had to sit down, stop what she was doing, and couldn't speak. These were odd spells, and I assumed she had developed frontal lobe epilepsy from the scar on her brain. Increasing doses of anti-seizure drugs seemed to work initially, but then the spells came back. A couple years after my diagnosis, her endocrinologist, who treated her for diabetes mellitus, checked her thyroid. It was super high. The spells were manifestations of hyperthyroidism. She drank the radioactive iodine cocktail which ablated her thyroid, got on thyroid replacement therapy, and felt well thereafter. No permanent harm done, and she was able to come off the anti-epilepsy drugs. She was obese, not the typical skinny hyperthyroid patient, and if she developed thyroid eye disease, I couldn't tell because her one eye was already so messed up. I see how I screwed it up. But in retrospect, I have never been sure what I could have done differently, except test her thyroid at the outset of treatment. Hence, a lot of patients, thousands, have had their thyroid checked by me since then. Every so often I pick up an abnormality and it gets treated. The lady was an employee of the hospital where I trained, and I ran into her one day. She gave me a hug and let me know how this had all gone down. She made a point of wanting me to know she didn't blame me, because I always seemed to care about her and what happened to her. I think about her and how I screwed up her diagnosis and set back her care almost every day. I am a much better diagnostician now, but I always remember this case, and it reminds me not to get cocky or be too sure that my working diagnosis is correct. Edit. This was very early in her career, and she practiced for another 25 years without major incident. Fun story. While my wife was having her C-section for our daughter, she overheard one of the nurses say there's only 9, and my wife thought they were talking about my daughter's fingers or toes. So she's freaking out that our daughter is missing a finger or toe, and I keep assuring her that our daughter was perfect, which she was. We found out about 10 minutes later that the nurse was talking about the surgical tools that were supposed to be accounted for, and one of them was missing. So my wife got to spend the next 2 hours in X-ray because they thought they had left a tool inside my wife and stitched her up. They found the missing tool, not inside my wife, a couple hours later, so that was a relief. When I was a student rotating through OB/GYN, and I wrote an order for a woman's postpartum continuation of magnesium sulfate as she was pre-eclamptic antepartum, I was super careful because I knew what could happen with magnesium toxicity and double-checked the order with the resident afterward. The nurse, instead of hanging one bag of mag sulfate and another of I forget what, hung 2 bags of mag sulfate, one of which she slammed into the patient over a minute instead of slow infusing over 12 hours. The woman told the nurse she didn't feel right, and the nurse pooh-poohed it. I happened to be walking by and stopped in to see what was up. There they were, 2 bags hanging, both marked in a bright red warning label. We called for the fast response team. They, and my team, got there in time and took over. But she still went into respiratory depression and ended up in the ICU. We all make mistakes, some of which are dangerous. I've absolutely made my fair share. I've misdiagnosed or tried to save patients from a trip to the ER, and they've ended up in the ER anyway, just later. As long as you recognize your mistake and make an effort to improve afterwards, and it wasn't too neglectful, egregious, I understand. But I reamed the nurse when I overheard her laughing about the incident like she hadn't just almost killed someone. I don't know what she thought, getting told off by a rotating student, but I was pissed at the time. Farmed here. Couple different quick stories. Heard of a pharmacist who filled a fentanyl patch incorrectly, and the dose was so high that the patient went into severe respiratory depression and died. They're still practicing. Worked with another pharmacist back in the mid-2000s when I was still a tech who filled a script for Prozac solution. Concentrated it is 20 milligrams per ml. Average adult dose is 20 milligrams. Instead of 1 ml once daily, he filled it for 1 teaspoonful, 5 ml. The child got serotonin syndrome and almost died. He is no longer working to my knowledge. My grandmother has had diabetes for about 20 years and takes a handful of meds to help control it. About 10 years ago, she developed a persistent cough. It wasn't bad. She said it felt like a constant tickle in the back of her throat. She went to her doctor to find out what was going on, and he ordered a battery of tests concerned that she was developing pneumonia, lung cancer, etc. All the tests came back negative. So he prescribed a cocktail of pills to help combat it. Over the span of 5 years, she had tried about 35 different meds and none helped. One day when she went in for a routine checkup, her normal doc was out, and she saw one of the on-call residents. He looked at the barrage of pills she was on and asked why. When she explained, he replied, "Oh, the cough is a side effect of this one particular drug you're on to regulate your insulin. If we change you to this other one, it will go away." My parents are nurses. They knew a doc who'd been on a 36-hour shift. Patient came in with a punctured lung, I think, and the doc had to collapse the lung to fix whatever was wrong with it. Through tiredness, he collapsed the wrong lung, and the patient died. Doc ended up killing himself after being fired. Don't burn yourself out. Someone else tragically lost their life years ago, but the incident saved my sister's life about 10 years later. Several years ago, my sister and I were in a car accident. I had visible injuries. She did not, and was walking around without any problems, so we thought. 9 days later, she was preparing dinner, began to feel ill, vomited, and then passed out. She was taken by ambulance to the hospital emergency, and after talking to my brother-in-law for only a couple of minutes, he rushed my sister into surgery and removed her spleen immediately. It had ruptured in the accident, but was a slow bleed. My sister was in ICU for a couple of weeks, but survived and is in good health today. Later, the admitting trauma surgeon said he recognized what was happening because of a mistake his college professor told the class she made as a surgeon years earlier. A teenage boy had fallen from a cliff and hit rocks below. Other than being bruised, he was fine, so did not seek medical help. 7 days later, he was brought unconscious into ER, where the college professor was working as a surgeon at the time. She and her team were not able to quickly identify his symptoms of a ruptured spleen that had happened 7 days ago. The teenage boy died about an hour later. She was always sure to share this particular incident with her students, thus saving my sister's life when one of her former students, my sister's doctor, showed up to class that day. As an ICU nurse, I've seen the decisions of some doctors result in death. Families oftentimes don't know, but it happens more than you'd think. It usually happens on very sick patients that ultimately would have died within 6 months or so anyway. Procedural-wise, I have seen a physician kill a patient by puncturing their heart while placing a pleural chest tube. It was basically a freak thing, as apparently the patient had recently had cardiothoracic surgery and the heart adhered within the cavity at an odd position. I'll never forget the look on his face when he came to the realization of what had happened. You rarely see people accidentally kill someone in such a direct way. Heartbreaking. My first day as a camp nurse for people with intellectual disabilities, I gave 9 pills to the wrong guest. I didn't know who I was looking for and asked my friend to send out the guest. His hypochondriac roommate walks out, tells me he is the person I'm looking for. I asked my friend for confirmation, who thought the correct person had come to me and confirmed from afar that it was, and I administered the meds. He had a lot of drug allergies. Stomach dropped when the actual person I was looking for came out 12 seconds later. Luckily, we called poison control, and most of the pills were vitamins, and the ones that weren't were either similar to ones the guy was already taking or in therapeutic low-dose form. He was fine and still continued to ask for everyone else's pills at all times. Worked there 2 summers and thankfully had no other disasters like this one. Too long, didn't read, poisoned a guest on my first day of work. Dentist here. I was performing a simple extraction and preparing for the case when I didn't realize that I had the X-ray flipped the wrong way the whole time. I was viewing the film backwards and pulled out the wrong tooth. When I realized my mistake, I started freaking out, only to find out that by some dumb luck, the tooth I extracted had to go as well. For the record, this happened in dental school, so safe to say it was a learning experience. It was my first and very last time to make that mistake. And yes, we are doctors. Don't forget to like and subscribe and turn on notifications for more awesome content.